We also wanted to also say, at Tafari we teach you techniques of patient transfer and safety, and maybe we go to the detail of understanding patient condition. Now, there are some of you who will have your loved one having fracture. You have seen people with a fracture hip. Okay, so we at Tafari, we don't believe that care is just care. We want care that is meaningful. At Tafari you will learn. Let me use this wheelchair. At Tafari is not care just for the purpose of care. Like you, oh, okay, I'm also a caregiver. No, you are not just a caregiver. At Tafari, you use your brain. We want you, when you live, whatever you do, when you bring that wheelchair of the patient to transfer the patient out of bed, and then you do it in a manner that is with brain, not just care. So let's proceed. This is one of the things. One, when I bring this wheelchair here, I want to make sure it's locked, then it will not move. If I'm going to transfer my patient from the bed, so I'm going to proceed by the wheelchair is locked in a position that it cannot move. So I go both sides and lock it. Now, I'm moving this patient out of the bed, and the patient has fracture. So I'm going to make it, let me make it short. So this patient has a fractured right hip. This is the leg that, first of all, what does it mean when a patient has fracture on one leg? So the mobility of that leg is limited. It's not going to move like this other leg. Number two, pain is another thing. Number three, now, is the patient's ability to participate in care. Is not there. It's limited ability to participate in care. Now we are depending on you as the caregiver to transfer this patient to bed. Now I'm going to ask you this. Come. What's your name? Esther. Esther, you are this patient now. And I've turned you, and now you are seated here in bed. Set at the end of the bed. Yeah, like this. Remember, where does Esther have a fracture? This hip is fractured. What does this? Just think. At Tafari will teach you this. When Esther is going to be moving this way, this leg has limited mobility compared with this leg, because this leg is the fractured leg. Now, if I move Esther towards the fracture